Welcome friends in the Genuine Practical Homeopathy. So today topic is about confusion about the genus Epidemicus. So friends, since our CCRH and Ayush Ministry advised about the genus Epidemicus to prescribe as a homeoprophylaxis arsenic album. So lots of confusion are in the homeopathic field. Most of the time in the homeopaths, in the students, and so many doctors from other fields also. So they are in confusion about how we discovered this genus Epidemicus. That's why they are in dilemma and they are in confusion and they have doubts about this is right or wrong. But friends, all the teachings of Master Hahnemann, when we follow it, we can understand what the genus Epidemicus is. So there are so many myths are spread in the homeopathy to discover about the genus Epidemicus. But the master's teachings are very scientific, very practical. That's why I always say to the homeopathy that master advised us it is a genuine practical homeopathy, and these sentences are said by Samuel Hahnemann himself to his own successors, his true successor. When they are following the Master Hahnemann's teachings, then and then we call it as a genuine practical homeopath. Friends, if we are following the master's teachings and master's guidelines in each and every management in the homeopathy, so we don't get any doubts and any confusion, and there is no any unscientificness. So master himself in the footnote 1, he said that he is not making empty speculations or any hypothesis. But still friends, we are making too many hypotheses regarding the theory of this genus Epidemicus. So friends, I am Dr. Santosh Mahanor. Here want to explore you, want to clear you confusion about the genus Epidemicus. What are the master's teachings? Is it scientific or not? So friends, please watch this slide. I will show you what are the master's teaching regarding the genus Epidemicus in very short view. So it is not very detailed elaboration of the genus Epidemicus. It is in a very short template that I want to show you. So friends, this is a template. I want to elaborate you about the genus Epidemicus, how master's theories are advocated in this. So here is a genuine practical homeopathy I mention always, because master said that you should be a very genuine in your practice, or your approach should be a practical. That's why he said to his true successor, that is the genuine practical homeopathy. So in that, about the genus Epidemicus, master advised us about in the aphorism number 100 to 103. You may refer it. So I'm not going to discuss in details about what the given in the 100 aphorism and 102 and 103. But still I want to make it very clear, very in short, to about understand detail about it, and I'm not giving any knowledge to you. So it is just an information what I gathered from the master's teaching. So in that, master said that if you are treating the genus Epidemicus, your approach should be a very different, because this disease is very new to the community. It is not a previous approach, because in this epidemic or pandemic disease, there is a very different, very peculiar protocols or peculiar pathological progress of the disease is seen in all over the globe. And according to the symptoms from globes, we are collecting the data from each and every where master said that you don't collect the data from only 1, 2, 3 or 4. He never give any number, that is 10 number, 100 number, and whatever it may be. But he said that you should collect the data from several patients. So these several words indicate that you, until and unless you are not satisfied with the correct picture, correct portrait of the disease, you don't make it a correct image of the disease. So for the Master Hahnemann, correct picture of the disease means you have to understand about its details, all the phases, all the pathological signs and symptoms that we should collect it. So first part of the Master Hahnemann is, unless and until you can't make it a correct image of the collections of signs and symptoms of COVID-19, then and then, so next step is comes in front of you, that is we need to make it similimum. Which drug has such type of pathological affinity and presentation, or the symptoms are present in the Materia Medica. So for that, I would like to suggest you that please refer the signs and symptoms from the theory of chronic disease, where Master Hahnemann written about the symptoms of arsenic album in the form of subjective as well as objective diseases, objective type of symptoms. So friends, if you can make it very similar with the symptoms of this COVID-19 and symptoms of arsenic album, so you will very get clear very soon. Most of the homeopaths, so they are aware about the law of similia. They are get cleared about that what are the symptoms in the arsenic album, what is the pathology in the arsenic album that matches with the COVID-19. But friends, there are some other doctors are also introducing another remedies like camphor, gelsemium, bryonia, and so many. But friends, these remedies are also come in the reparation, or if you are finding the very similar in the Materia Medicas, where those Materia Medicas are genuine, but they are very partial. They are not making a correct and totality of the picture. So these remedies are might be useful into the different phases of the patients while we are curing the cases. And after when we get a cure of so many patients with the same drugs, so when outcome comes in front of you after treating the patient, then and then we can say that these drugs might be a very true genus epidemicus. That's why we need to treat the patients simultaneously. But friends, so in our homeopathic community, so there is a lot of confusions are there. That is red light. I want to show you in the red light. It indicates the signals, road traffic signals. आपको दिख रहे होंगे यहाँ पे. So this red light means we are stuck there because of due to we are stopped. We are not using our minds. We are not using our scientific approach. So most of the problems are arises because of due to the hypothetical theories. What are the hypothetical theories? So many physicians, so many homeopaths are introducing their own hypothetics. So that's why we, our followers or their doctors get in confusion. So if you have any clear scientific approach towards this genus epidemicus, then come in front of CCRH and others scientific community and give a proofs to how you are prescribing this type of drugs. So it makes it very clear to the other homeopaths also. Another important thing, the imaginative Materia Medica. Most of the doctors are following the imaginative Materia Medica. Most of the theories like constitutional Materia Medica, so many mind methods, and so many types of things, constitution physical approach, and pathological approach. So many things are there. So I call it as an unscientific approach. We people are not following the master teaching that he said in the 100 to 103 and in the chronic disease and all these things. If we are doing all such type of things, we are approaching to the epidemicus to unscientific approach. Science should be a considerable. There is, if you I am wrong, so I has to be accept it. I am wrong and go forward. What are the scientific proofs with me? And I have to show to the world what are the scientific proofs I have. And accordingly, we treat the patients not only into the genus epidemicus but also in several other cases too. So friends, so when we can get our clear about this confusion, automatically we get a signal. There is a yellow light. So when the yellow light, we just see here and there, and then everything is clear. Then we make a green light and we just uh, walk away on this path. So that is the genus epidemicus. That genus epidemicus is arsenic album, and this arsenic album is I guarantee that it works in approximately 80 to 90% of the patients. So we just understand, we just collect the data from the large samples after prescribing to the arsenic album. So friends, while you are prescribing the arsenic album to the community, just keep it record of the patients in authentic form. And when this outcome will come out after 1 month, 2 months, and 3 months, so we are able to show to the CCRH and to the Ayush Ministry what we did. So friends, this is about genus epidemicus. So whatever may be the problems and confusions, I want to make it clear here. Hope you understood about what I want to show, what I want to make share with you. So whatever possible, I make it very simpler and very clear. But friends, still you have any doubts, any confusion, So I will give you my mail ID in description box. You may mail me. I will be with you for your help. So friends, thank you. Please like, share this video with our homeopathic community and friends.